Good morning, everyone. So today I'm going to talk about the importance of nose and the chin in respect to rhinoplasty and genoplasty. So uh, nose and the chin, they play a very important role, how they balance the overall face. They're in the center, they're the most projected part of the body. The nose is the most projected part of the chin, of the face, whereas the chin is the second most projected part of the overall face. So you can see here in my picture here, before and after rhinoplasty, only in a patient whose chin is extremely receding. So when you see the line, the straight line drawn from the nose tip till the anterior portion of the chin, ideally the line should not be extremely steep, and there should be at least around about 4 millimeters gap between the lower lip and the line drawn from the nose and the chin. And you can see here before the surgery, when I draw a straight line, the lips are actually, both the upper and lower lips are actually touching the line. The lower lip is not only touching the line, it's going through the line. Whereas after the rhinoplasty, wherein the nose has been projected forward, the bridge has come forward, her overall proportions nose looks better, but because her chin was already very small, the nose chin looks even more smaller after the surgery, and making her nose as if her nose is over projected as compared to her chin. Now, finally, in these three pictures, what we've done is we've balanced her chin with her overall face. And now you can see when we draw a straight line, there's around 4 millimeter gap between the lip and the line. And overall, her face looks much more well balanced. So this is how we do rhinoplasty. When you have a small, short, flat nose, you have to project the nose. When you project the nose to balance it, so your nose is basically balanced as per your forehead, your eyes, your cheeks, and your upper lips. So when you project it, if you have a good chin, it will look fantastic. But if you happen to have, unfortunately, a smaller chin, the nose may look over projected, which should be actually ideally addressed by getting your chin in a proper position. So now you can see here again one of my patients who's undergone a rhinoplasty. It's about 2 months post-surgery. So you see here, she's inherently got a very extremely small chin, along with very non-existent nasal bridge and a very wide nose tip. Now, the only way to get her a better nose is to project her nose, get her a better bridge, get her a more projected nose tip. But because her chin is small, it will look over projected. So you can see here in this picture itself, when I hide the lower face, her nose looks fantastic. The nose looks very well balanced with her forehead. The tip looks fantastic compared to with the nose. The philtrum, the skin above the lip here, it looks very good. But the moment I remove it, you can see here when I show the full face, on one side, we have the natural picture, the original picture, wherein I've not addressed her chin at all. So here you see the nose, which was looking good before this, looks more over projected. But whereas when I simulate her chin to look in an ideal position, how ideally the overall balance should be, automatically the entire profile gets much better. Her nose starts to look much more well balanced because her overall face is in a better balance. So you can see here the difference that in the line when we draw in a receding chin, when you do a rhinoplasty, when you project the nose will look over projected because the chin is actually receding. The nose is actually normal, it's in a more balanced position. But because the chin is abnormal, it will look abnormal. It may not look that good. Again, we have one more patient of mine who underwent same rhinoplasty. But here also, you can see here that when I draw a straight line from nose tip till her chin, you can see here when the nose is unoperated, her lip, her nose, her chin is in a balanced position. Because her nose is unprojected, the moment I do a rhinoplasty, I am going to project the nose to make it much more better. So the moment we do that, her chin looks more receding, the nose looks like over projected. Whereas on the next picture, on your right-hand side, I've done a Photoshop where I've simulated her chin getting into a more proper positioning. And you can see here automatically how the overall face looks more balanced. So both cases you see here, both of them have relatively shorter chin as compared to the rest of the face and the nose. And from the front, irrespective of whether they have done their chin or they have not done their chin, they look, they look good. The nose looks good. They look perfectly fine. But from the profile view, because their nose chin is extremely small, they look out of balance. And the moment I do a simulation of their nose of the chin, looking into a better position, automatically her entire face, they roll to both of the patient, entire face becomes more balanced. Same way you have here a male patient who I've done a rhinoplasty as well as a chin surgery, and you can see here how well balanced the patient looks here. The nose is well projected, it's much more higher. The chin also is well projected. The same thing you can see here, both male and female patient of mine who had smaller chins, smaller, flatter nose. When I project their nose and the chin together, they yield better results. So it's very important for everyone to understand that when you're looking at rhinoplasty, you also have to look at your chin proportions also. And it's always better that when your doctor tells you that you've got a small chin, it would be better if you do your nose along with the chin. End of the day, it is for your own better proportions, because sometimes when you project the nose in a proper position, the smaller chin may look even more smaller. Thank you.